September is Sepsis Awareness Month. So I just want to run through some of the signs of sepsis, because obviously this is a condition that when it hits fast and it hits hard. And the problem is that we often don't treat it until it's too late, and then it becomes a much more difficult condition to handle and more life-threatening. So there's a few things that we know is signs and symptoms of sepsis. Number one, they don't feel cold and clammy. They feel warm to touch, quite warm often. Their skin will feel warm, but it will be pale. As they get further on, the extremities, the hands and feet and things like that become more pale and cool. But to begin with, they're warm. We know that a later one is that you will get some blueness or tinging around the lips, and you will also get that around your fingers and toes. That's called peripheral cyanosis. We do get that in the later stages, but in the first stages, you may just think the lips look a little paler, like they're not getting enough blood, and that's a key. The blood flow is becoming an issue. They may complain of feeling a little bit lightheaded, dizziness, or be a little bit stumbly, or you've noticed that maybe they're not quite with it. They just look like they're coming down with a cold or the flu, and they're a bit achy, they're very, very tired, and they're just a bit withdrawn and low and a bit slurry with their words, and they kind of spike a fever, or they feel very warm to touch, but not cold and clammy. That's the key. Often if you look, you may find that some of the skin looks blotchy. Not necessarily a rash, but more blotchy, like a different sort of skin reaction. And again, people assume flu, chest infection, allergic reaction. Often it can be a sign of sepsis. So knowing that, you need to go and get it checked immediately. Low body temperature can also happen, not just fever. So people are always going, well, it's not sepsis because they ain't got a fever. But hypothermia can happen too in sepsis. It can go either way. So they can be hot, they can be cold, they can have chills, they can have hot flushes, they can be burning up. But the skin itself doesn't tend to normally feel cold and clammy. It tends to feel warm and clammy. Equally, rapid heartbeat and low blood pressure. And that's often what's causing the dizziness, because again, there isn't enough oxygenation going into that blood. Any worries with sepsis, seek medical help instantly. This has been Thoughts with Points. Take care.